So Emily, it'd be great if you could just give a quick introduction, and then we'll get right into your questions.
Sure thing. Thanks, Ansley, for having me. And it's always a pleasure to be on and to follow Amanda from Stanford. I've already heard about her new role, and we're very excited to be working with her at Stanford. We currently work with the Industry Relations Committee there. So I've already heard about her incoming role, and I'm excited to be working with them. But excited to also be here today to tell you a little bit about myself. I've since November of last year been in an AI lead role within neurology at UCB, still digital care transformation. And so very excited to be talking about all the latest, and there's just too much to discuss, right? So I had to be very tailored in what I wanted to focus on today, but I'm excited to talk to you about what's been on my mind lately.
Absolutely, and I'll get right into it. So how does artificial intelligence currently being utilized in neurology, and what are some of the most promising applications that you're seeing?
Yeah, so I think the best answer to this question is diagnostics, and particularly imaging. There's been tons of progress there. And I'm not a radiologist by training, but I do know that AI is really helping, at least deep learning models can automatically detect and highlight abnormalities in imaging, particularly in MRIs, CTs, and PET scans. So it can actually identify tumors and lesions and pathological features in imaging, which is at a greater speed than it was before. Obviously, it was done by a radiologist. It still is, but AI can highlight those areas of interest for the radiologist to take a particular look at. It also can help with segmentation and quantification within imaging. So think about actually looking at brain volumes. AI can help to assess what that looks like, especially in conditions like Alzheimer's or FTD, frontotemporal dementia, where there's brain atrophy, and in like MS, where there's lesion loads and you need to be looking at lesion counts. So AI can help with image analysis and interpretation, but it can also help with noise reduction. So actually things called convolutional neural networks are used to reduce noise in the image and reduce artifacts in the imaging data to make the image clearer and more accurate. And it can also help with resolution enhancement. So you can actually visualize fine details. I mean, think about it when you have a lens of a camera, right? Just making things sharper. So, those subtle changes in brain imaging structures can be seen better with the enhancement of AI. We're also seeing that with the automated kind of assessment of those scans, that there's automated first drafts of radiology reports being written. And certainly the clinician and radiologist can edit those and add to them before signing off on them. But that is certainly an advancement that's been within the last couple of years. And I specifically work in neurology in epilepsy. So we also have seen advancements in the reading of EEGs. So actually using EEG signal to predict epileptic seizures. So not only detecting the seizures themselves as they're happening, but saying they're about to happen. Mm-hmm. So we've been working with many different companies on predicting seizures using AI-read EEG data. And then the last two things I would mention is AI is certainly used for risk assessment. So looking at genetic, lifestyle, and clinical data to really think through what's somebody's risk of developing a neurological disease, as well as prognosis. So AI models can predict disease progression and actually even predict complications so that you can be more proactive in enabling better management of preventative care.
Well, I had no idea that AI could be so useful in diagnostics and imaging and a variety of different things in neurology. I think that's so interesting and definitely good for the future. And how also can AI help with personalized treatment plans for these disorders? And are there any challenges in implementing such as approaches?
Yeah, so the beauty of AI these days is the ability to put lots of different kinds of data together, so multimodal data. Mm-hmm. And so, we're seeing the ability to put together genetic information with medical history, with lifestyle, with imaging, with biomarkers, to find patterns amongst all that data. And that data can then be used, particularly in the treatment space, for drug response prediction. So we can see how each patient might have a personalized treatment strategy based upon some of those factors. And it can also be used for dosage personalization. So once you actually find a treatment that you believe is the best one, you can optimize that treatment dosing with minimizing adverse events and then improving that therapeutic outcome. So it's not only finding the right dose of one therapy, but it might be several therapies. So like what is the best combination of therapies to put a patient on if they're on a biologic and some kind of other immunosuppressant, for example. And aside from patient care, I have to mention that AI is also being used. There's a huge effort in drug repurposing. So drugs that are already approved, finding new uses for them and new indications. So that's kind of what's most exciting in terms of challenges in that space. Certainly generalizability of algorithms is difficult. You definitely need to do the clinical validation, I believe, at more of a local level for each implementation. So there has been a big call, especially out of UCSD. Chai, I'll take a moment here to say, the Coalition for Healthcare AI definitely wants to have a nationwide assurance labs approach, which I totally agree with. And it's great to simulate the AI models and see kind of in silico how they work. But I also believe the biggest challenge is implementation science, right? And so we need to make sure that these models generalize at the local level. So there also should be kind of an implementation pilot approach to actually making sure these algorithms are working for folks at the local level. So I would say integrating it into workflow and generalizability of the algorithms, certainly transparency and interpretability are hot topics. But certainly the clinical validation is the biggest challenge that we need to make sure we're doing.
And when you're talking about the kind of integration aspect, I'm curious to know, how should healthcare professionals be prepared to integrate AI and digital technologies into their practice, specifically in neurology?
Yeah, I mean, there's no one size fits all answer to this. I think it's the answer across the board, which is, first of all, it should start with good training of physicians. So I know a lot of medical schools are thinking through how do we change the curricula right now to make sure that the physicians are really prepared. Number one, that they don't feel like they're being replaced, but number two, that they feel like these tools are complementing them, and that they feel well prepared to interpret kind of the insights that AI is giving them and really incorporate it into their clinical judgment. But I also think that they should be taught to critically evaluate the systems, right? So not just blindly trust them, but look for the model cards, look for how what data was used to train the models, to really build confidence in these tools and accept and utilize them. But then in terms of actually implementing, I know a lot of systems have run the AI models silently behind the active or live system, which I think is a good way to start. But obviously piloting is the best way to do it. So actually having a gradual implementation process, troubleshooting that process and refining it based upon kind of real world feedback from clinicians. I know there's a lot of lessons learned from the sepsis model rollout with Epic, that there was a lot of alert fatigue, et cetera. So I think, I will harp on again, the implementation science component cannot be overstated. And there needs to be a feedback loop in there in which the clinicians are able to give RLHF, reinforcement learning with human feedback, and actually tell the system, no, I don't believe this is correct, and here's why, and help to actually train the model itself. But we need to make sure these systems definitely are satisfying clinicians and are undergoing kind of a continuous improvement process. So, yeah, those are the things I would start with.
Just to start, of course. I know we have a lot that's going to evolve, of course, over the integration with the AI and in diagnostics stuff in neurology. But this is so interesting for just to talk to you about this, because again, it's not something that I was aware of, that we can use AI to actually help with imaging and diagnostics and really help to integrate, with the physicians and kind of help collaborate and make hopefully their world a little bit easier moving forward, and also help with that patient engagement as well. So thank you so much, Emily, for joining us today. It was always a pleasure to talk to you, and look forward to talking to you soon as well.
Likewise. Thanks for having me on.